All right, everyone, we're at 12 o'clock, so let's go ahead and get started. So thank you for joining us today for our UNC Injury Prevention Research Center webinar series. My name is Ciara Scott, and I'm a project manager here at the center, and I will be moderating today's webinar. And today we're going to be having a presentation from our Associate Director of the Injury Prevention Research Center, Dr. Beth Moracco. And following her presentation, we'll have some dedicated time for discussion to answer questions that come up for you all from this presentation. And then we'll just wrap up by briefly forecasting our next webinar, which will also be our final webinar for this academic year. And so before I get started, I also just want to give a quick housekeeping update to you all that for the first half of this webinar, we disabled your mic and camera functions so that we can just protect the recording from any accidental interruptions. But once we get to the Q&A, you will have the ability to unmute your mic to ask questions and engage in discussion with Dr. Moracco. But for now, you should be able to utilize the chat function and the Q&A function. So throughout the presentation, if you have questions that come up, you can feel free to start dropping those in the chat or the Q&A. And when we get to that portion of the webinar, I'll put those questions out there to Dr. Moracco to begin answering. So without further ado, I'll go ahead and introduce you all to Dr. Moracco so she can get started on her wonderful presentation for today. So Dr. Beth Moracco is a researcher and public health practitioner with expertise in intervention development, evaluation, and collaborative partnership and community engagement. Her research focuses on the primary and secondary prevention of gender-based violence in the U.S. and global settings using qualitative and quantitative methods. Dr. Moracco is the Associate Director of the UNC Injury Prevention Research Center, and she is also an Associate Professor in the Department of Health Behavior at the Gillings School of Global Public Health. And in addition to her leadership responsibilities, Dr. Moracco serves as a primary investigator and co-investigator on a number of studies funded by the CDC, the Office of Violence Against Women, and the National Institute of Justice. So with that, Beth, I'm going to pass it over to you to get us started for today.
Thanks, Ciara. Thanks everyone for being here. I see a number of familiar names and faces, so it's really great to see you in this environment. I'm going to share my screen, and I practiced this, so I'm hoping that I do it correctly. Okay, can everybody see my screen?
Looks great.
Wonderful. So as Ciara mentioned, or as you saw from the beginning of the flyer for the presentation, I'm going to be talking about Project Restart, which is a project that we've been working on for almost 3 years now. So what I'm going to be talking about today is, first, I'm going to introduce the Restart team and actually see that at least one of our members is here today as well. And I'm going to give you some background about domestic violence intervention programs, what we know about them, their origins, and what we know in terms of the evidence base about their effectiveness, what's missing, and what are some of the limitations of current approaches. Then I'm going to talk about some innovations or potential innovations to DVIPs, including restorative justice approaches, transformative justice approaches, and other innovations. Then I'm going to talk a bit about our Restart conceptual model, the formative work that we've done thus far, and next steps. And finally, we'll have some time for Q&A. So I want to just introduce our wonderful Restart team, and I really need to give credit to Professor Deborah Weissman. This was her idea. She contacted me about 2.5, almost 3 years ago, saying that she had some ideas and did I know of any students that might be interested in ways that we could really rethink our approaches to DVIPs. And Deborah and I have worked together in various ways for over 20 years. And so I said, this is great. We've got fantastic students and others who'll be interested. And so we have put together kind of as a labor of love, this project team, Julia Campbell, who is a doctoral student in health behavior, who's on my left in the column there. Erica Redding, another doctoral student in health behavior. Cindy Nicola, who I actually saw her name earlier. I should say Dr. Nicola, because she successfully defended her dissertation just a couple of weeks ago. Scarlett Hawkins, who is in global studies, and Dr. Nicola is from the Hussman School of Journalism and Mass Communications. And then Mallory Velez, who's a law student and MPA student, and Bridget Nelson, who is an MPH student in the health equity concentration. The equity concentration. So you can see that it's an interdisciplinary team, and I think that's one of our strengths. And as we know, issues around violence, particularly gender violence, really need a transdisciplinary approach. But I also want to talk about how important it is to have policy and practice partners. We've been in really close contact with people at the Center for Justice Innovation. That's the new name for the Center for Court Innovations before that. The North Carolina Providers of Abuser Treatment, the Spark Foundation, and then we've also been in close collaboration with the Council for Women and Youth Involvement, which is a council within the Department of Administration, which also houses the Domestic Violence Commission. So I know this will be review for many of you, but why we're interested in DVIPs is because intimate partner violence and domestic violence is a huge problem globally and in the US. The CDC defines intimate partner violence, and I'll use these terms interchangeably. In public health, we tend to use IPV, or intimate partner violence, but in most kind of legal and community settings, folks use the term domestic violence. But both those terms basically mean physical violence, sexual violence, stalking, psychological aggression, including power and coercive tactics, by a current or former intimate partner. So a spouse, a boyfriend, girlfriend, a dating partner, same-sex partner, or ongoing sexual partner. And that we know, and these data are from the National Intimate Partner and Sexual Violence Surveillance Survey, that about 41% of people who identify as women and 26% of men experience contact sexual violence, physical violence, or stalking by an intimate partner sometime in their lifetime, and report partner violence related impact. And I'll say that the data that we have now on trans folks and non-binary folks, we're starting to get more data, but the numbers aren't big enough yet to be reported. And then we know that 1 in 5 homicide victims are killed by a current or former intimate partner. And for women, half of female homicide victims are killed by a current or former intimate partner. And that IPV is associated with just a myriad of negative physical and mental health outcomes, and it incurs a huge societal cost. So IPV is widespread, it incurs huge costs. And so one of the things that we need to do is to both prevent and address IPV perpetration. So there are programs that have been developed to address IPV or domestic violence perpetration. They are also known as batterer intervention programs, or BIPs. We now tend to call them domestic violence intervention programs. And in 48 states, these are statutorily authorized as a sentencing option in criminal court for domestic violence offenses, or as conditions for a domestic violence protective order. So this is by statute, a perpetrator or an alleged perpetrator can be mandated into one of these programs. And so they were initially developed in the late 1970s to address men's violence toward their female partners. And this was part of the battered women's movement. And they generally take a psychoeducational approach, which is focused on men's utilization of power and control. And there's an emphasis on changing men's kind of beliefs, patriarchal beliefs, with the belief that that will then change their behavior. The most well-known version of DVIPs is what's called the Duluth model that was developed by the Domestic Violence Organization in Duluth, Minnesota. It was called the Domestic Abuse Intervention Programs. And about half of certified DVIPs use some variation of the Duluth model. So as I mentioned, in most states, court-mandated participants must attend a certified DVIP, so one that has been certified. Often state statutes mandate what the standards are for certified DVIPs, and the guidelines might be developed by designated agencies. Most of these programs have a fee associated with them, or anywhere between a couple of $100 to over $1,000. And that there are fines or even jail time that are imposed by non-attendance, non-completion, or failure to pay fees. Many of these programs are offered by nonprofit organizations, and often, oops, sorry about that, let me go back. And often these organizations don't receive state funding, and so they're reliant on fees. So what do we know about how effective these programs are? There were some early meta-analyses in the early 2000s that found that DVIPs were only minimally effective in reducing recidivism, and that the more rigorous the studies were, there seemed to be an inverse relationship. So the more rigorous the study, the less likely you were to find effectiveness. Now, I'll say that there are a lot of issues with how recidivism was defined in these studies. Often it's by rearrest, which we know is a very incomplete measure. Then some more recent studies have found inconsistent positive effects. One large meta-analysis that was done in 2013 found that, kind of combining all these studies, that in just a little less than half, about 42% of those studies, they found a positive effect of the DVIPs. And there's some research that has looked at comparing different program approaches. One pretty consistent finding is that DVIPs that also included substance abuse and trauma-related content had better results, and there have been some inconsistent findings around using cognitive behavioral therapy. But all of this research needs to be taken with a giant grain of salt because there are a lot of methodological limitations, high attrition rates in the programs. The programs themselves have very different participants. We don't know if they're implemented with fidelity, and the outcome measures are not necessarily comprehensive and appropriate, and often not with a lot of survivor input. So we don't really have a good read on how effective these programs are because the research has been inconsistent. But we do know that there are some limitations. One is that there is a real reliance on criminal and civil legal approaches. There's a lot of good, understandable reasons for why that is, and I'll talk about that in a couple of minutes. But particularly as we are in an era of reckoning and an area of looking at criminal justice reform, relying so heavily on the criminal and legal systems for such a complex issue is problematic. We also know that the early programs and the programs that most of DVIPs are based on, although there have been adaptations, have a very heteronormative focus, and so might not be appropriate for other groups and aren't necessarily inclusive. And again, because they tend to focus on psychoeducational determinants, there's a lack of attention to these structural drivers of IPV. And there's been a lot of good research now that's recognized some of those societal forces, that kind of outer ring of the socio-ecological model that drive all types of violence, including IPV, including structural racism and poverty. And that there hasn't been a lot of attention to individual, group, and historical trauma, especially ACEs. There have been several studies that have shown that court-mandated participants, or DVIPs, have very high ACEs scores. By ACEs, we're talking about adverse childhood experience. So there's a high burden of trauma among participants. And that there's not always survivor involvement in terms of their preferences. Most programs are mandated to inform the partners and former partners of participants that the participant is in the program, et cetera, but there's often not a lot of collaboration in terms of their preferences. And again, I've mentioned this a couple of times and I can't help myself because I'm a researcher, but how we've measured success has really been inadequate. So we have the opportunity, as we're kind of taking a step back and kind of re-looking at our approaches to a lot of violence prevention, in incorporating some innovations to DVIPs. And one potential innovation is using a restorative justice approach. Now, there's no way that I can actually do justice, no pun intended, to restorative justice in a slide or two, or even a 15-minute presentation. So I'm just going to go over just a few of the principles of restorative justice approaches. And I say approaches because there's not one set menu of activities for restorative justice, but there are principles and approaches that guide RJ. And so I think one of the best kind of shorthand descriptions is that restorative justice approaches seek to promote the agency of those harmed, address the harms and their causes, and provide a framework for accountability and an opportunity for healing. So we're not talking about, dismissing accountability, which I know is one of the fears that people have about RJ, but it's seeking to promote agency of those who are harmed, so survivor-centered, keeping accountability, but really promoting healing. So the approaches and activities may vary, and we know there's a long history of restorative justice practices in Indigenous communities, and that they've been used for centuries to respond to conflict and harm. More recently, they've been used to address a variety of crimes, and they've demonstrated efficacy and cost effectiveness, and also yielded higher victim satisfaction. And these are small pilot programs across a number of different crimes and types of harm. And again, centering the agency of the survivor, it allows the person who has been harmed to tell their story, if they want to, and compels the person who has harmed to acknowledge their responsibility. So again, it's not a way of relinquishing that accountability. And there's some very legitimate concerns that have been raised by particularly IPV advocates, DV advocates, recognize that there's a power imbalance inherent in IPV and DV, and that, we fought for decades to get IPV to be taken seriously, to be recognized as not just a private matter, but a societal concern with real harms. And so, by kind of taking it out of the criminal or, augmenting the criminal and civil justice approach, are we getting back to privatizing this issue? Another potential innovation is transformative justice. And transformative justice approaches, they recognize the need to understand and intervene upon the structural mechanisms that result in communities and residents' differential exposure and vulnerability to violence. So the difference here between TJ and RJ is really that structural approach. Let's look at those structural drivers of violence and address those as a way to address violence. And there's a lot of overlap between transformative and restorative justice, and sometimes RJ approaches can be addressing structural factors. Often TJ processes culminate in a plan that includes broader community involvement. And transformative justice usually operates outside of state institutions and really leverages community resources. Other potential innovations for DVIPs are incorporating a trauma-informed approach. So the four R's of trauma-informed approaches. And part of that is by assessing and addressing trauma among participants, including ACEs. And then also expanding services and case management to address the co-occurring needs of DVIP participants. We know that there are wide-ranging needs in terms of mental health issues, substance use disorders, housing instability, economic instability. And again, that's not to say that these are the unique causal factors for DVIP. Doesn't take the responsibility away from the participants, but it recognizes that in order to address the violence, we need to address some of these other co-occurring issues. So we've been working on Project Restart, as I said, for almost 3 years now. When Professor Weissman contacted me with ideas, she had just a little bit of research funds to fund a research assistant. Erica joined us in the fall of 2022 and actually wrote her own research grant to help fund the formative work. And then the next year, we were able to conduct a scoping review of the gray and peer reviewed literature in terms of what do we know about DVIPs and what do we know about restorative justice approaches. And we also conducted 7 focus groups with DVIP facilitators, domestic violence service providers. We also conducted 1 focus group with staff from the North Carolina Coalition Against Domestic Violence. And we searched for funding. We put in proposals to NIJ, we put in 2 proposals to the UNC Creativity Hubs, 2 to Felix Harvey, and 1 for COVID-19 funds, none of which were funded. We did some more interviews in 2022. We were abstracting our data. We submitted another proposal to NSF. And then we also submitted a proposal to the North Carolina Office of State Management and Budget and Valuation Fund, which was funded. I'll talk about that in 1 minute. I've got like 2 left. And then we started submitting some papers because we believe it's important to build the evidence base around this work. So I'm not going to dwell on this because I know I'm running out of time, but you'll have the slides, it'll be on YouTube. But this is a great program. I just want to put in a big plug for the North Carolina Evaluation Fund grant. Just started this is the first cycle of it. And it partners state organizations with researchers to kind of augment the kind of rigor and evidence base for these programs. So we partnered with the Council for Women and Youth Involvement, and we were funded. And I'll talk about kind of what we're doing for that in just a minute, but I want to show you what we produced as part of Project Restart is our conceptual model for why we think these innovations will actually decrease morbidity and mortality, both for perpetrators and survivors of IPV, perpetrators will desist from DV perpetration and self-harming behaviors, and there'll be increased well-being for all. If you look at the looking at my screen, it's the far left-hand side of the conceptual model. We think the innovations that are really pillars are trauma-informed approach, partnering with social justice and economic justice organizations, and using restorative justice principles. And again, you'll have this model to kind of get a closer look. But what we're doing with our evaluation planning grant is we are creating 4 deliverables. We're going to be identifying critical program components that we believe would make up comprehensive DVIPs, and also ways to measure those components. Our second phase is to identify the gaps in measurement tools and indicators for current DVIPs and for innovations to DVIPs. So how are we measuring these, and what's missing? And then once we've identified what's missing, we're going to develop and test new measures for effectiveness of DVIPs. Hopefully that'll give us better ways to measure how effective these programs are. And then because our work actually also coincides with Domestic Violence Offender Management Committee's revision of their best practices manual, we're also going to be working closely with them with our findings in order to kind of inform their revisions, and hopefully also revisions to the administrative code. So what's next for us? And Ciara, I promise this is the last slide. We're going to continue to work on our grant. We are going to develop a logic model based on our conceptual model. So a logic model that really spells out program activities. We are going to provide recommendations, as I said, to the best practices manual and the administrative code. We're going to keep submitting manuscripts to peer-reviewed journals and also producing practice-based documents that can be used by practitioners. We are going to identify community partners for pilot testing the model program that we develop. We're going to keep looking for funding. As I said, this is a labor of love. Most of us are volunteering on this project. And then once we do secure funding for our pilot, we would like to pilot test an innovative DVIP and then eventually do an efficacy trial, so a larger scale trial if it does prove to be effective. So that is all I have. I did go a little bit over my allotted 17 minutes. Sorry about that, Ciara. I'm going to stop sharing. There we go.
No problem, Beth. Thank you so much. That was a great presentation, and it sounds like really interesting but important work. So thank you so much. So now we want to open it up for questions. So if you have any questions for Dr. Moracco, you can feel free to drop them in the chat, or you can use the raise hand function, and I will call on you and you can unmute and ask her directly. And I believe I just updated the settings, so you should be able to do that. See something in the chat. Oh, just a comment. Super interesting work.
I think Elise has a question.
Oh, thank you. Yes, Elise, go ahead.
Can you hear me?
Can you say that again?
Can you hear me?
Yes.
Okay. Hi, Elise Keefe. I'm at the Injury Prevention Research Center as well. So it's been years since I was really involved in domestic violence research, intimate partner violence research, but I was curious. This was a topic of interest for me very much, the restorative justice framework and IPV. So thinking back, something that I found really interesting was, I think it was Johnson's model of like a typology
Yes.
of abuse. I'm curious how that, or if that plays a role in this at all, if there's any like, been any evaluations as far as like, yeah, tailoring any of these programs, or if that's something that you all intend to look at.
Yeah, that's a really good question. And when you talk about Johnson's typology, you're talking about like the common couples, there's like the common couples violence, the more kind of coercive controlling. So he actually has developed these kind of typologies of IPV. What you're referring to?
Yes.
Yeah, and they're definitely, I mean, I think part of this assessing, doing trauma assessments and also kind of lethality and danger assessments with participants is really important. And I think there are very, very well justified concerns about safety for survivors, right? Using an RJ approach. I already mentioned kind of this power imbalance and, making sure that, we are remaining survivor centered. And, if a survivor does not want to participate, then of course, game over, right? That's not kind of, that's not how RJ works. And I would imagine from what I know about those typologies that there probably would be certain types of participants who would not be appropriate for RJ approaches. And I'm not sure if that's what you were getting at, Elise. I haven't seen any research. The research that has been done on DVIPs kind of lumps everybody together. And I think that was one of the critiques of some of the research was that, there's a real heterogeneity of participants. And so, kind of looking at, are there certain types of participants for whom the DVIPs work better than others? I think we just don't know.
Yeah, that was essentially my question. Thank you.
All right, we have another question in the chat from Lizzie Sager.
Hey, Lizzie.
So she says, looking at who the partners on this project are, this looks like it will be very North Carolina focused. Are there any other states who have done this kind of DVIP research evaluation or have best practices or statewide guidance in place that are trauma informed?
Yeah, that's exactly what we're looking at as part of our scoping review. And then there's also an MPH student who's looking at curricula, who's looking at state guidelines, and that's part of kind of what we're pulling together for this, recommended components kind of piece. In Utah, there were 2 small RCTs where circles of peace. I'm trying to remember what the name of the DVIP was, where they did have a DVIP that did use restorative justice approaches, and it was small, so there wasn't a lot of power, statistical power, but they did have promising results. Again, measuring recidivism in terms of rearrest, and I think they also had self-reported behaviors, and they may have contacted, I think they may have done a focus group with partners. So there's a little bit there, there are some, there's some work that's going on across the country, and we're identifying that. We've also been working really closely with the I was going to say the Center for Court Innovations, but they now have that new name because they also compile kind of best practices and recommendations. And they're actually on all of the grants that we wrote that haven't gotten funded yet, they're consultants on the project as well, because you're right, Lizzie, it's very North Carolina focused in terms of where we would implement a pilot and kind of the impact that we can have now. But if we do see promising results, it's something that we want to scale up and test in different settings.
Right. We do have one more question in the chat, and we also have a minute left. So
Okay,
I'm going to give
I'll
time.
be brief.
I'll give time for that question. I just want to say I'm going to put a link in the chat to our post-evaluation survey, and I'll send a follow-up email as well with it, and with information about our next webinar. So the final question in the chat is from Rebecca Gibson, and she wants to thank you for your presentation. And she's also curious about your perspective on how RJ work can be infused into the college processes.
Yeah, that's a really good question. I've been thinking a lot about that because there have been a few not evaluated, but kind of, pilot studies that have used that word campus sexual assault. And again, I have the same misgivings that I did, that I do and I continue to have about, using them for DEIPs in terms of, questions about power imbalance, questions about manipulation, questions about safety, questions about agency. But I think, the more I understand about RJ and the more I see how it's been used in other settings, I really do believe that we can incorporate those principles in a way that's very survivor-centered. And also, one of the issues with relying on civil and criminal justice systems is that the survivor doesn't really have a chance to tell their story in a way that they want to tell their story, right? Or that they want, or have really any agency in how things proceed. And so I think that, what's promising about RJ practices is the ability to do that. I went more than a minute. I'm sorry.
You're all good. Thank you so much. And thank you all for attending today. Like I said, I'll send a follow-up email with information about our next webinars and the link to the evaluation survey again. So thank you.
I want to give a huge shout out to the Restart team too. It really is the work of everyone. And, again, a labor of love. We're really doing this, because we like each other and we like the project. So.
Right. Well, thank you again, Beth, so much for this presentation today.
Okay.
And thank you, everyone. Have a great afternoon.
Bye. Sarah, do you need anything else from me? Do you need me to have my email on the slides if people want to contact me?
Yeah, no, I don't need anything else from you. I'm not going to send them your slides. I'm going to send them your contact info.
Okay.
So I'll send them your email and then tell them where to find the recording. And then I'll be working with Carol to get that up on the website. So they'll be able to see the slides, in the recording.
Perfect.
But yeah, I don't need anything from you. That was great. Thank you.